Somerset Care provides residential and nursing services for elderly people in 30 homes in southern England and also manage a respite centre for adults with physical disabilities in Taunton. Our ethos is to deliver first-class care to all our clients in every aspect of their lives, striving to achieve the highest levels of physical and mental well-being. We are always looking at innovative ways to keep our customers as healthy and happy as possible. To this end, we recently embarked on a hydration initiative. Hydration is an important part of the care that we deliver, as is the promotion of our clients' independence. We are always open to new ways of achieving these aims. That is why we were interested in getting involved with Hydrate for Health. The company supply hydration solutions aimed at many different types of user. Our aims and objectives of the hydration project were to promote independence, dignity and a person's well-being, reduce the use of medication, especially antibiotics and laxatives, reduce the chance of infection, reduce the likelihood of a fall, reduce hospital admissions. The project was carried out over 2 months, June and July 2014. 8 of our homes were chosen to take part in the research, and they each selected 10 residents to be involved. 57 people in total completed the project. Hydrate for Health delivered a day's training to the staff. Homes were given a client assessment tool and a protocol for the implementation and use of hydrants in the homes. Data was collected for 2 months prior to the project, and then during the 2 months of the project. Criteria were set around the use of antibiotics, use of laxatives, total number of falls, number of pressure ulcers, number of hospital admissions, number of urinary infections with and without a catheter in situ, chest infections, cellulitis. One of the homes included was Moorhaven on the outskirts of Taunton.
We are a 54-bedded home for residents with residential needs, and we do have some residents with first-stage dementia. Derek's a gentleman that used to stay in his bedroom. He wouldn't eat or drink very well. We introduced the bottle. He looked healthier. He actually seemed more awake and more alert. We've been to visits to the doctors where doctors have done a review with him, and they are very impressed that he's actually even left the building to go to reviews. He's been on trips into town.
Freedom. You can come and go within a reasonable area, like.
We noticed that actually they weren't having the illnesses, weren't having the falls, so we didn't have to call the ambulances out.
Prior to using the hydrant, Michael was reluctant to drink and required a nurse 2 to 3 times a week due to infections. During the 2 months of the trial, whilst using the bottle, there were no call-outs and no antibiotics needed. He has been drinking a lot more independently and is able to take his hydrant wherever he goes, and says he feels healthier. The Hulken Centre offers different challenges for hydration.
The typical client that comes to us has quite complex needs, and the use of the hydrant has been useful for those individuals as it's so easily accessible for them. The clients have gained greatly through the use of the hydrant. It gives them independence to be able to drink by themselves without having to ask a staff member or a loved one to get them a drink. It gives them the dignity of being able to give themselves a drink without having to ask.
This is Robert. He's a 50-year-old gentleman. He's lived at Hulken for 25 years. Me and Robert had a chat previously, and he tells me the thing that he most likes about the hydrant is that it's so readily available. It can clip to his shirt so that he can access it whenever he likes, and that he likes it because of the independence it gives him. He can have a drink whenever he likes, and he doesn't need to ask a staff member for it. Is that right, Rob? Out of everybody, I would say Robert's benefiting the most from the hydrant. You know, he likes drinking plenty, so you know, for Robert to have something that's so easily accessible for him is great, and it's clean.
Some of the clients noticed immediately a real benefit from using the hydrant. and overall there has been a 25% reduction in the areas that were analysed. 6 of the homes saw no or slight improvements. 2 homes saw significant improvements. Here there was an 80% reduction in falls and a greater than 50% reduction in all other areas, such as the use of antibiotics. 1 home saw a 78% reduction in total events. The Hydrant delivers great benefits for our customers, including increased independence, minimising the use of antibiotics, reducing doctors' visits and hospital admissions.